Well, is it the cold and flu or that dreaded Memphis crud? What's the harm in waiting to find out? We've got the doctor's orders and today's local health alert. Congestion and coughing, those aches and pains. Unfortunately, it's going around with the holidays right in our rear view.
You've been with Uncle Bob and Aunt Sue during all this time and the little kids and everything.
Warm and fuzzy feelings that don't last long when in some cases the germs set in.
What we're seeing a whole lot of right now is two things. The famous Memphis crud of sinus and bronchitis, and then we're starting to see the actual flu.
Dr. Mark Castellaw with Baptist Memorial Healthcare says your temperature will help tell the story.
The key thing is fever. Usually if you've got the flu, you're going to have a fever, 101, 102, 103.
A low-grade fever is typically linked with the crud.
People with the Memphis crud are still pretty functional. They can get around. They just got blowing their nose, coughing up stuff.
But in either case, it's not a bad idea to give your doctor a call and get an appointment before it lingers, especially if the cold symptoms stick around more than 3 days.
Even the sinus and bronchitis that you can get with that can easily lead to pneumonia.
And while it circulates through the season, your best bet is to constantly wash your hands and your personal space.
If you work with a computer, your computer station, keep it wiped down and clean.
Now, it's also not too late to get a flu shot. Dr. Castellaw says just remember they take 2 weeks to become effective. He also warns people on prescription drugs to be careful about what over-the-counter medications you're taking for a cold and how they could impact your daily prescriptions.